Thank you very much for the opportunity to present our work here. So this project is joint work with Erika Serrano, who's sitting just in front of me, and we'll both be happy to get your comments and feedback about this ongoing project. This is also joint work with Philip Castral, who's a grad student at UPF. And what we're trying to do in this paper is to, in this project, is to try to think about how incentives affect an organization's performance, right? There's been quite a lot of work, both in the private and in the public sector, thinking about what are the effects of pay for performance for frontline service providers on a different array of final outcomes, right? And we've seen papers looking at the education sector, at the health sector, and so on. However, if you put this in contrast with what we see in the private sector, for example, think about a large hedge fund. So most of the performance incentives are located in the upper levels of the organization, right? The CEO is the one who gets the big bucks for the performance of the organizations, right? Which leads us to start thinking a little bit more about what are the interactions between these different layers of an organization, right? Of course, if you think about health service provision, as is the case of the organization we're working with, you have frontline service providers as well as their supervisors, managers, and so on, right? So the and you can perfectly think that when you incentivize one layer of the organization, there's going to be spillovers and effects on the other layer of the organization, right? And this could go through different mechanisms. One of them could be effort complementarities. If I see that my supervisor is putting much more work, that can affect my own performance. But it could also be that you have some negative spillovers, like for example, through fairness concerns, right? I feel like I'm doing the job, but someone else is getting rewarded for it, right? And also this speaks to this research that we're going to be doing speaks to a very important concern from the point of view of the policymaker, right? So if the policymaker has a certain bucket of money, the main question that you want to answer is, where should I put this money in order to maximize the organization's performance? So this is exactly what we're going to be testing in joint work with the community health worker program in Sierra Leone, right? The research question that we're going to be asking here is whether incentives given to one level of the organization will affect the whole organization's performance, and how would it spill over to the other layers of the organization. I'm going to tell you a little bit more about what specifically we're talking about here, but as I mentioned before, you can think about two different types of spillover, right? A positive spillover where you have effort complementarity between the layers, and a negative spillover through fairness concerns, right? Of course, the fairness concerns are going to be at play here only in the cases where I know how much my supervisor is making, right? And this is a point that I'm going to come back to towards the end, because here is one of the issues where we want to most feedback from you guys, right? And again, this is an important policy question, because the question that came up when we were, so this project is a result of an ongoing collaboration with the Ministry of Health and Sanitation in Sierra Leone. They completely reorganized the community health worker program after the Ebola crisis, and the main question that they had is that UNICEF has given us this big pot of money, where should we put it? Okay? So let me tell you a little bit about the context. We will study these questions in the context of the community health worker program in Sierra Leone, which was recently reformed after the Ebola crisis. And there were a number of issues, and the most salient issue in terms of how they wanted to reform the project is how to pay these guys. Right, that there were a bunch of people citing all these papers about pay for performance, and the question is how to implement this pay for performance system, right? So and the way the community health worker program in Sierra Leone is organized is not unlike many frontline service provision in other countries, and even in other sectors. You have the community health workers, who live in a certain community. They have very limited medical training. Typically, they have between 10 and 30 hours of training on preventive and very, very basic healthcare. They live in the community. This is a part-time job. They're, of course, not expected to spend 40 hours a week on this. And their job is to monitor the health status of people in the village, treat some diseases, the ones that they are not able to treat, to refer them to the peripheral health unit, which is the big health center that agglomerates several communities in their catchment area. And the most important emphasis here is in post and pre and postnatal care, right? So making sure that pregnant women go to the checkup on time, that they have an institutional delivery, and afterwards the follow-up for the children, vaccination, and so on, right? Most of the responsibilities of these guys can be, in general, summarized in 9 main activities, right? And this is going to be important for us. The second key figure in the community health worker program is a peer supervisor. Right? So each peer supervisor is in charge of monitoring, advising, training, and supervising the health workers. Right? So they are typically about 9 community health workers under each peer supervisor. Right? And the peer supervisor just travels around, talks to the guys, tells them, okay, what have you seen lately? Have you had trouble with anything? Also, they collect data. All right? Our sample is of 372 peer supervisors and the 2,700 CHWs that work under them in 6 districts in Sierra Leone. These guys are paid a fixed wage. The CHW is paid 100,000 leons. The peer supervisor is paid 150,000 leons. Just so you get an idea, the minimum wage in urban areas it's about 500,000, right? So obviously this is not a full-time work. And before we started working with the health workers, they were volunteers, and in an assessment that we did to get this project started, we found out that the average CHW in these communities worked about 4 hours a week. Okay? So we are going to run, we have already started randomizing. So this is an ongoing project. We started in like 4 months ago. And the randomization is at the peer supervisor level, right? So we're going to randomize how steep is the incentive structure within the organization. One unit is going to be the peer supervisor and all the community health workers working under her. Okay, so in the first treatment arm, we're going to put all the incentives on the top layer of the organization. All right, and the incentives are based on the performance of the community health workers who are working under her. Right, so for each job, Freddie is a community health worker in my catchment area. If Fred does one activity, one visit to a pregnant mother, I'm going to get 2,000 leons. Okay. In the second treatment arm, the bulk of the incentives is on the lower level of the organization. Right. So this is your standard pay for performance for frontline service provision. For each of the services that you provide, you get 2,000 leons. In the third treatment arm, the incentives are going to be shared. For each activity done by the CHW, both the CHW and the peer supervisor are going to get 1,000 leons each. Okay, so the first question, the first challenge that we faced when we were thinking about this idea is, okay, so how are we going to measure and monitor this, right? And what we did is to design a reporting mechanism using cell phones, right? So each community health worker is supposed to write down everything they do. The only thing that we did is to put on top of that cell phone reporting so that we get access to live data on what is going on, right? So you basically provide a service. you type you send us a text message with the code of the service and the phone number of the patient, or the mother of the patient in case it's a kid. Okay, so we have live information about what these guys are doing all the time. Once we get these messages, this goes into a large data set, and we have a team of phone clerks back checking all these all these reports, because of course if the payment is being based on this, we don't want to have trouble with over-reporting. So we call back the patients, and we not only ask whether the service was delivered, but also we ask a series of procedural questions of stuff that should have been done in case you saw a child that was malnourished, for example. Okay. On top of that, a second concern is not only over-reporting, but under-reporting. So to deal with under-reporting, we also have a team of field monitors who are going to each village and showing up and trying to ask people, okay, have you been treated or not? And then talk to the community health worker to say, hey, I've talked to this person who has been treated, but you didn't report it. Okay, so these are our two measures to look at reporting or under-reporting. Our main outcome variables are going to be health outcomes from a household survey. We're going to get a CHW effort from both the reports and what the households tell us that the CHWs have been doing. And to get at the peer supervisor effort, we're going to ask the community health workers how often have they been visited, the quality of these visits, and so on. So this is where we stand right now. We are roughly halfway through the project, and there is scope for doing more, right? So one of the key questions here is that if the pay structure for the peer supervisor is private information, there are two potential channels that can affect the performance of the organization. One is the individual effort, and the second one is effort complementarities. However, in many of these types of organizations, this type of information could be also public, right? Which opens up another possibility, that there are fairness concerns, right? The PS is getting money for the work that I'm doing, so I might want to punish this person because I just don't like inequality and so on. Okay, so there are two options that we see here going forward, and here is where we would like your input. One is to just keep the experiment as it is, with information be about the pay structure being private. So the qualitative work that we've done so far tells us that some people find out about how much are their supervisors making, some not. And in this case, what we're going to be able to identify are going to be the individual effort and the effort complementarity effects, with some sort of heterogeneity analysis on whether you know how much your PS is making. The second option that we see forward is to randomize pay transparency, right? Basically to publicize, to make public the information about how much the PS is making. But and even though this would allow us to get this additional channel, which we think is quite important, there's some risk. First, it will reduce power because we have 372 units divided in 3 tribunals under control, so would have to cross-randomize this. So there are risks on power, but also on spillovers and so on. So here we are facing several trade-offs that we are happy to discuss later. And I guess
take some questions.
Yeah, I'm done. So I'll just leave this up. Yes, sir.
I just have a question about how realistic it is to keep the information private. I mean, in a pretty tight-knit group, maybe the CHWs are spread out enough that you can keep the information private. But my concern would be within an organization or a cohort of people doing a certain job, they'll hear about what their bosses.
Yeah. So these guys meet once a month, right? So once a month there is a meeting, and our intuition is that if you reveal information at the individual level about pay structure, money, everyone talks about money all the time. Yeah. So within the PS unit, the information is going to be spreading around very, very likely. So what we're leaning towards is that if we do this randomization, it would be at the PS level. Right? It would be a cross randomization at the PS level. Yes, Bilal.
So I was just kind of curious. I was trying to think about it because at some level, the split incentives. You know, you could imagine a world where if you incentivize the PS, they essentially go and split. They go downstream and incentivize the CHW. You can also imagine CHW has some kind of a hold-up power as well because ultimately they're delivering the frontline services. I wasn't sure. So I was just trying to think about this. Maybe I missed this, but does the PS have a say in terms of the hiring and firing of the CHW with inclusion in the network? What is their kind of sort of locus of control over them, and how do you think about this in the context of some bargain and hold-up problem where everything kind of converges to your third treatment?
So the selection was given when we started the project, and actually the peer supervisor is called peer supervisor because he or she used to be a CHW. So when we announced the treatment, what we did is to talk to the peer supervisor and told her, look, this is the incentive structure. This information is out here. We've only told this to you, but you're absolutely free to do whatever you want, right? And last time that I was in the field, one of the things that I saw is exactly what you mentioned, right? That this person publicly announced the incentive structure, and they were sort of bargaining. By the time I left, they were sort of bargaining on how to split the pie. So we're certainly collecting that information. But this is information from one unit that I observed, no? But we have, yeah, we've been tracking all the information about side payments inside the organization and trying to get at the bargaining for sure. We haven't looked at the data carefully enough yet. Yes.
Yeah, I find it interesting that you're having, it looks like you would have your control group also needing to report in on the activities that they've done. So I'm just curious, is that, like, in the settings that I work, that's just, I don't think we could expect anyone to do something like that without any type of incentive to actually report. So have you thought through that, and are you doing it because this is like government request or interest?
Yeah, no, so our main outcome variable are the health status of the population, right? But to try to get at the effort mechanisms, definitely we want to do as much as we can to use the reports. So to get at that, what we are doing is that we told people that we would pay 10,000 leons every month, conditional on truthful reporting, right? And truthful reporting implies is verified either by the phone clerks that get at over-reporting. So for the control group, that wouldn't do much. But also through the people who are going around the country verifying and trying to get at under-reporting. So at this point, I don't know to what extent we will be able to have a very consistent data set coming from the text reporting. We are doing as much as we can to be able to use this high-frequency data.